Imagine that your brain is a city, and the blood vessels are the roads that connect it. The blood carries oxygen and nutrients to the brain cells, like trucks delivering goods to the buildings. Now, what if one of the roads gets blocked by a traffic jam or a bridge collapses? The trucks can't reach their destinations and the buildings start to run out of supplies. If this happens for too long, the buildings will shut down or even collapse. This is what happens when you have a stroke. A stroke is a medical emergency that occurs when the blood flow to a part of your brain is interrupted. There are two main types of strokes, ischemic and hemorrhagic. Ischemic strokes are caused by blood clots that clog the blood vessels in or near the brain. These clots can form when the blood vessels are narrowed by fatty deposits called plaque, or they can travel from another part of the body, like the heart or the legs. Hemorrhagic strokes are caused by bleeding in the brain or around it. This can happen when a blood vessel bursts or leaks. Your brain is not a uniform mass, but a complex organ with different regions that perform different functions. It is divided into two halves called the left and right hemispheres. They are connected by a bundle of nerve fibers called the corpus callosum, which allows them to communicate and coordinate. Each hemisphere has its own specialties and preferences. For example, the left hemisphere is usually responsible for language and speech, while the right hemisphere is more involved in nonverbal and spatial skills. This means that a stroke can affect different parts of your brain in different ways, depending on which hemisphere is damaged. Let's take a look at some of the possible effects of a stroke on each side of your brain. If you have a stroke in your left hemisphere, you may experience paralysis or weakness on the right side of your body. You may also have problems with your speech and language, such as difficulty finding words, forming sentences, or understanding what others say. This is called aphasia. A stroke in your left hemisphere can also affect your memory, your reasoning, your learning, and your attention. You may become more forgetful, more confused, more slow, and more cautious. If you have a stroke in your right hemisphere, you may experience paralysis or weakness on the left side of your body. You may also have problems with your nonverbal and spatial skills, such as judging distances, sizes, speeds, and positions of objects. This can make it hard for you to do simple tasks, like picking up things, buttoning your shirt, or tying your shoes. You may even fail to notice when something is upside down. A stroke in your right hemisphere can also affect your perception, your memory, and your behavior. You may ignore or forget the left side of your body or the left side of your environment. This is called left side neglect. By making some simple changes in your lifestyle, you can prevent a stroke. The most important thing you can do is to control your blood pressure. High blood pressure is the main cause of stroke. It can damage your blood vessels and make them more likely to clog or burst. So check your blood pressure regularly and keep it within the normal range. You can do this by eating less salt, taking your medications, and managing your stress. Another important thing you can do is to eat a healthy diet. Choose foods that are good for your heart and brain. Eat more fruits, vegetables, and whole grains. Eat less red meat, processed meat, and saturated fat. Eat more poultry, fish, and unsaturated fat. Avoid added sugars and limit your alcohol intake. A healthy diet can help you lower your cholesterol and your blood sugar. High blood sugar can damage your blood vessels and make them more prone to bleeding. So check your cholesterol and blood sugar levels regularly and keep them under control. You can do this by eating well, exercising, and taking your medications. Exercise is another healthy habit that can help you prevent a stroke. It can improve your blood circulation and your heart function. It can also help you lose weight and reduce your stress. You should aim for at least 150 minutes of moderate exercise per week or 75 minutes of vigorous exercise. You can do any activity that you enjoy, such as walking, jogging, cycling, or swimming. Just make sure you consult your doctor before you start and do it safely.